Treatment for addiction is tailored for each patient. Sometimes medications play a part, and often treatment can be on an outpatient basis. Dr. Harry outlines the compassionate and effective care that helps the patient work towards a drug-free life.
The biggest myth about addiction is that it's not treatable. It's absolutely treatable, but it has to be treated for life.
Dr. Harry reveals what a person can expect when they make that first call to talk to someone about their addiction.
I think you have to realize that the people who are well-trained, the professionals on the other end of the phone, automatically think that this may be someone who needs help. And that's why they're there, to help you with a medical disease, to help you with a medical problem, potentially. Their directives are to follow that the way they would follow for any medical disease. Assist the patient to get out of dangerous situations if one exists, to facilitate a very timely appointment for them to come in and talk. Addiction is treated extremely humanely, sometimes with medications assisting that and sometimes without. But some of these addictions can put someone in danger. Dangers of seizures, danger of withdrawal symptoms, danger of excessively high blood pressure readings, and so forth. We'd like to assess that sooner than later. So it's a very user-friendly, loving environment, oftentimes with people who personally, certainly professionally, have a lot of experience with this drug in their own lives and the lives of people they have loved. So they're going to treat it with respect and dignity.
Addiction recovery can be undertaken as an outpatient.
I try to meet the patient where they are. And if that means that they have a family, that they have kids going to school, that they need to make dinner that evening or show up for work, that may be entirely possible if we're getting to the disease early enough in its course. There are all levels of care, and for many people who are proactive, that level of care can be on an outpatient basis. You go home at night, you can sleep in your own bed. We'll monitor that patient very closely. If we find that it's not safe for them to be at that level of care, we may suggest the next level of care, which can be more residential, like the more traditional 30 days that you've heard about in the past. But oftentimes we're able to treat people in their own walks of life without disrupting them terrifically.
Regulations ensure that patients' personal information stays private.
Like all medical diseases, a person with a substance use disorder or an addiction, and we use the terms interchangeably, are protected by some very serious laws of confidentiality. That means the paper trail and the patient's information is controlled by the patient, and that information goes nowhere. Only if signed permission is given to us can we share with other family members or their own doctor. We never report anybody. We never call their employer. We never do anything unless, of course, they're putting themselves or someone else in a dangerous situation, and then there's room for discussion. But for the most part, it's extremely safe and patient-friendly.